Imagine waking up one morning and realizing that every seemingly harmless routine you have kept for years has been silently damaging your kidneys. Surprising, right? But here's the truth that most seniors never hear until it is too late. Your kidneys, those small but incredibly powerful organs that work nonstop to filter toxins, regulate fluids, and maintain your blood pressure, can lose up to 50% of their function before you feel a single symptom. They do not complain. They do not send you pain signals. They just quietly deteriorate until one day a routine blood test reveals chronic kidney disease, and by that point, the damage is usually irreversible. Today, I am going to reveal the 10 daily habits that could be sabotaging your kidney health right now. These are not rare behaviors. They are patterns that millions of seniors follow every single day without questioning them. And the habit at number one is the most dangerous of all, because it is the single largest preventable cause of kidney failure in people over 60. My name is Dr. Michael Williams, and protecting kidney health is something I discuss with my patients constantly because the kidneys are one of the most underappreciated organs in the human body. They filter approximately 50 gallons of blood every single day, removing waste, balancing electrolytes, and regulating blood pressure. When they fail, everything else follows. So let us go through these 10 habits, starting at number 10. Number 10 is holding in your urine. It is a situation most people have experienced. Busy with something in the middle of a task, or simply too comfortable to get up. But habitually delaying urination places unnecessary stress on your bladder, which can lead to incomplete emptying and increase the risk of urinary tract infections. When those infections travel upward to the kidneys, they can cause serious kidney infections. Chronically retained urine also gives minerals extra time to crystallize, contributing to kidney stone formation. Make it a practice to use the restroom when you feel the urge rather than holding it. Number 9 is overusing over-the-counter pain relievers. Non-steroidal anti-inflammatory drugs like ibuprofen and naproxen are most people's first choice for aches and pains. But these medications work by reducing blood flow to the kidneys, which impairs their function over time. Chronic use can cause a condition called analgesic nephropathy, a type of permanent kidney damage that leads to a gradual decline in function. If you find yourself reaching for these medications regularly, talk to your doctor about safer alternatives for long-term pain management. Number 8 is not drinking enough water. Your kidneys need adequate fluid to cleanse waste from the blood and eliminate it as urine. When you are chronically dehydrated, your kidneys cannot perform this essential function efficiently, leading to toxin accumulation and concentrated urine that can irritate the kidneys and promote kidney stone formation. Aim for 6 to 8 glasses of water throughout the day, adjusted for your activity level and climate. Number 7 is eating too much salt. When you consume excessive sodium, your kidneys must work significantly harder to remove the extra salt from your blood. This additional workload strains the kidneys and can gradually reduce their function. Excess salt also causes fluid retention, which increases blood volume and raises blood pressure, one of the primary drivers of kidney damage. Most of the excess salt in our diets comes not from the salt shaker, but from processed foods, canned soups, deli meats, and restaurant meals. Prioritize fresh fruits, vegetables, and herbs to season your food naturally. Number 6 is relying heavily on processed foods. Beyond their high sodium content, processed foods are loaded with sugar, unhealthy fats, and chemical preservatives that collectively stress the kidneys over time. They also tend to increase the acidity of your body, forcing your kidneys to work harder to maintain proper pH balance. Regular consumption contributes to weight gain, which increases the risk of diabetes and hypertension, both leading causes of kidney disease. Number 5 is ignoring high blood pressure. Hypertension is one of the top causes of kidney damage, yet many people do not fully appreciate its effect on kidney health. When blood pressure is consistently elevated, it damages the delicate blood vessels within the kidneys that are responsible for filtering waste. Over time, this leads to a progressive impairment called hypertensive nephropathy, where the kidneys gradually lose their filtering capacity. Monitoring your blood pressure regularly and working with your doctor to keep it controlled is one of the most effective things you can do to protect your kidneys. Number 4 is consuming excessive sugar. A diet high in sugar leads to weight gain, insulin resistance, and eventually type 2 diabetes, which is one of the primary causes of kidney failure. High blood sugar damages the small blood vessels in the kidneys, impairing their ability to filter waste. Even if you do not have diabetes, chronic high sugar intake promotes inflammation and metabolic changes that stress the kidneys. Begin by reading food labels carefully and reducing sugary beverages, processed snacks, and desserts. Number 3 is smoking. The toxic chemicals in cigarette smoke enter your bloodstream and reach your kidneys, where they trigger inflammation and damage the delicate blood vessels responsible for filtration. Smoking also decreases blood flow to the kidneys and worsens other kidney risk factors like high blood pressure and diabetes. The encouraging news is that quitting smoking produces significant benefits for kidney health, even after years of use. Within weeks of stopping, circulation improves and stress on the kidneys decreases. Number 2 is drinking too much alcohol. Your kidneys are responsible for filtering alcohol, which is a potent toxin, from your bloodstream. Excessive drinking forces the kidneys to work overtime, causes dehydration that reduces kidney blood flow, and can raise blood pressure, all of which damage kidney function over time. Long-term heavy alcohol use can lead to a condition where the kidneys progressively lose their ability to function effectively. Moderate your intake to no more than 1 drink per day for women and 2 for men. And number 1, the most dangerous habit of all is neglecting diabetes management. Diabetes is the single leading cause of chronic kidney disease and kidney failure worldwide. When blood sugar is chronically elevated, it damages the tiny blood vessels inside the kidneys, progressively impairing their ability to filter waste and excess fluid. This condition, called diabetic nephropathy, develops gradually but can cause irreversible damage if left uncontrolled. Managing diabetes effectively through regular blood sugar monitoring, a balanced diet, consistent exercise, and taking prescribed medications is the most important thing you can do to protect your kidneys. Now, beyond avoiding these 10 habits, there are several proactive steps that kidney specialists recommend. First, have your kidney function tested at least once a year with a simple blood test, measuring creatinine and estimated glomerular filtration rate. Second, stay adequately hydrated throughout the day. Third, manage your blood pressure and blood sugar diligently. Fourth, ask your doctor or pharmacist for a comprehensive medication review, at least annually, as many common medications affect kidney function in ways that require dose adjustments as you age. Your kidneys are keeping you alive every single day without asking for anything in return, except that you stop doing the things that damage them. They are remarkably resilient organs, but they have limits, and once those limits are exceeded, the damage is usually permanent. If this video helped you understand the importance of protecting your kidneys, please subscribe. I share new content every week to help seniors take control of their health. And if someone you know is engaging in any of these habits without realizing the risk, please share this video with them today. Awareness is the first step toward prevention. I am Dr. Michael Williams. Thank you for watching, and I will see you in the next video. Take care of your kidneys and take care of yourselves.